Most people don't realize their kidneys are failing until more than half of their function is already gone. There's no sharp pain at first, no dramatic warning, just small changes that are easy to ignore. You feel tired all the time. Your face looks a little puffy in the morning. Your legs swell by evening. You wake up to urinate more often at night. And somehow, your body just doesn't feel clean from the inside anymore. Many people blame stress. Others blame age. Some think it's just dehydration. But what's really happening is far more serious. Your kidneys, two bean-shaped organs no bigger than your fists, are quietly struggling to do their job. I'm Dr. Marissa Blake, and for over 3 decades, I've worked with patients suffering from kidney stress, chronic kidney disease, and early renal failure. And I can tell you this with certainty: kidney damage almost never happens overnight. It builds silently, slowly, and invisibly. Every single day, your kidneys filter nearly 50 gallons of blood, removing waste, excess water, toxins, and balancing minerals like sodium, potassium, and calcium. They regulate blood pressure. They support red blood cell production. They keep your internal chemistry stable. When they begin to fail, every system in your body suffers. One of the earliest signs is persistent fatigue, not the kind that sleep fixes. This happens because waste products start accumulating in your blood, making your muscles and brain work harder just to function. Then comes swelling. When kidneys can't remove excess fluid efficiently, it collects in your tissues, especially the ankles, feet, hands, and around the eyes. Many patients tell me, "Doctor, my shoes feel tighter by evening," or "My rings don't fit anymore." Urine changes follow soon after. Foamy urine can indicate protein leakage. Dark urine may suggest dehydration or toxin buildup. Frequent nighttime urination often signals declining filtration efficiency, yet most people still don't act, and that delay is dangerous. The biggest enemies of kidney health today are chronic inflammation, high blood sugar, high blood pressure, excessive salt, and oxidative stress. Processed foods overload the kidneys with sodium and preservatives. Sugary drinks damage delicate filtering units called nephrons. Poor hydration concentrates toxins, and free radicals slowly scar kidney tissue. Once scar tissue forms, it does not regenerate. But here's the truth most people never hear. Kidney decline can often be slowed and sometimes partially reversed when addressed early with the right nutritional support. Not magic cures, not extreme detoxes. Simple, consistent habits that reduce inflammation and protect kidney cells. Let's talk about what actually helps. One of the most powerful natural protectors of kidney tissue is hydration, but not just any hydration. Plain water is essential, but pairing hydration with antioxidant-rich foods dramatically improves kidney filtration efficiency. This brings us to the first kidney-supporting food: blueberries. These small fruits are packed with anthocyanins that reduce oxidative stress inside the nephrons. They help protect kidney cells from damage caused by high blood pressure and toxins. Blueberries are also low in potassium, making them kidney-friendly even for people with mild kidney issues. Next, apples. Apples contain pectin, a type of soluble fiber that helps lower cholesterol and blood sugar, two major contributors to kidney damage. They also reduce inflammation and support gut health, which indirectly lowers the toxic burden on the kidneys. Then there's cranberry. Often associated with urinary tract health, Cranberries prevent harmful bacteria from sticking to the urinary tract and kidneys. Unsweetened cranberry juice or whole cranberries can reduce infection risk, which is critical for protecting already stressed kidneys. Red grapes come next. Their skins contain resveratrol, a compound known to reduce inflammation and protect blood vessels. Better circulation means better kidney oxygenation and slower tissue damage. And finally, watermelon. Watermelon is over 90% water and helps flush toxins gently without stressing the kidneys. It supports urine flow and reduces fluid retention. Its natural hydration effect is especially useful for people who struggle to drink enough water daily. Together, these foods reduce inflammation, oxidative damage, fluid overload, blood pressure strain. But food alone is not enough. Lifestyle choices matter just as much. Excess salt forces the kidneys to work overtime. Chronic painkiller use damages filtering units. Poor sleep raises blood pressure overnight. And ignoring early symptoms allows silent damage to continue. I once treated a 52-year-old patient who felt just tired for years. Blood tests revealed stage 2 kidney disease. By changing his diet, improving hydration, and reducing sodium, we slowed progression so effectively that he avoided dialysis entirely. That outcome is possible, but only if action is taken early. Your kidneys don't ask for much. They ask for clean fuel. They ask for balance. They ask for consistency. They don't fail loudly. They fail quietly. So if your body has been sending you small signals, fatigue, swelling, changes in urine, don't ignore them. Support your kidneys now, while they still have the strength to heal. Because once kidney damage reaches a certain point, there is no reset button. But today, right now, you still have a choice. Your next glass of water, your next meal, your next habit. That's where kidney protection begins. In part 1, we talked about how kidney damage begins silently, how early symptoms are often ignored, and how simple nutrition can protect these vital organs. Now, let's go further. Because understanding what destroys the kidneys is just as important as knowing how to protect them. One of the most misunderstood threats to kidney health is high blood pressure. Many people believe high blood pressure only affects the heart. That's dangerously wrong. Your kidneys are packed with tiny blood vessels, millions of them. When blood pressure stays high, these vessels are constantly under stress. Over time, their walls thicken and narrow. Less blood flows through. Less filtration happens. And slowly, kidney tissue begins to die. What makes this frightening is that high blood pressure often causes no symptoms at all until serious damage is done. Another silent destroyer is high blood sugar. In people with diabetes or even early insulin resistance, excess sugar in the blood damages the delicate filters inside the kidneys, called glomeruli. These filters become leaky, allowing protein to spill into the urine. Once protein leakage starts, kidney decline accelerates. That's why diabetes is the leading cause of kidney failure worldwide. But there's another culprit most people never suspect. Painkillers. Common over-the-counter medications like ibuprofen and diclofenac may seem harmless, but frequent use reduces blood flow to the kidneys. Over time, this can cause permanent scarring. I've seen patients with no diabetes, no hypertension, yet advanced kidney disease, simply because of long-term painkiller use. Then there's dehydration, which is far more dangerous than people think. When you don't drink enough water,
Toxins become concentrated in your blood. Your kidneys are forced to work harder under poor conditions. Repeated dehydration episodes, especially in hot climates, can slowly damage kidney tissue. Your urine is one of the simplest indicators of kidney stress. Dark yellow urine, strong odor, low volume. These are warning signs, not inconveniences. Now, let's talk about something hopeful, because kidneys, when supported early, are incredibly resilient. One of the most powerful protective habits is consistent hydration, spread throughout the day, not all at once. Small, frequent sips reduce toxin concentration and improve filtration without overwhelming the kidneys. Another overlooked habit is sleep. Poor sleep raises nighttime blood pressure and inflammation. The kidneys repair themselves most effectively during deep sleep. Less sleep means less repair. Then there's movement. You don't need intense exercise. Simple daily walking improves circulation, lowers blood sugar, and reduces blood pressure, all of which protect kidney tissue. Now let's address diet again, but more precisely. People often ask, what should I stop eating to protect my kidneys? The answer starts with excess salt. Salt causes fluid retention and increases blood pressure, directly straining the kidneys. Most salt doesn't come from home cooking. It comes from processed foods, instant noodles, packaged snacks, fast food, canned soups. Reducing these alone can significantly slow kidney decline. Next is excess animal protein. Protein is essential, but too much, especially from red meat, produces waste products that kidneys must filter. In people with early kidney stress, moderation matters. Balanced portions protect the kidneys. Overload damages them. Now here's something rarely discussed but critically important. Gut health. An unhealthy gut produces toxins that pass into the bloodstream, increasing the burden on kidneys. Fiber-rich foods help trap and eliminate these toxins before they reach the kidneys. This is why fruits like apples and berries, and vegetables like cabbage and cauliflower are so valuable. They don't just nourish, they reduce toxic load. I want to share another real case. A woman in her early 40s came to me with swelling, fatigue, and frequent urination. She was terrified of dialysis. Her kidney function was already declining. We didn't use extreme treatments. We didn't use miracle drugs. We focused on hydration, sodium reduction, sleep, gentle movement, and kidney-friendly foods. 2 years later, her kidney function stabilized. No dialysis, no transplant, just consistency. This is the part many people don't understand. Kidney health isn't about quick fixes. It's about daily decisions. Every salty meal, every skipped glass of water, every ignored symptom. They add up. Your kidneys are patient organs, but they are not invincible. If you're watching this and thinking, I feel fine, remember, most kidney disease patients felt fine too, until they didn't. Don't wait for pain. Don't wait for diagnosis. Don't wait for fear. Protect your kidneys while they are still quietly working for you, every second of every day. Because once they fail, life changes forever. And prevention is always easier than treatment. That's where kidney protection begins.